So hello everybody. So here today I'm with the lovely Louise Field from Adore Your Pelvic Floor, and we're going to be talking all things pelvic floor today, to really try and help give you some really good up-to-date evidence-based information on what you can be doing around helping your pelvic health to remain strong and happy as you age. So hi Louise, lovely to see you today.
Hi, Sarah. Thanks for having me.
So let's start by asking you, Louise, what are the main issues that women experience around their pelvic health, in regards to whether it's postnatally or as we age as women going through the menopause?
Okay, so stress urinary incontinence when we're lifting, shouting, laughing, is really common. And that is because our pelvic floor has got to be able to cope with the load placed upon it. So as we shout or sneeze or cough, belly laugh, and exercise, then there's a constant load that is coming down through the torso into the pelvis, or up from the feet into the pelvis. And we need the pelvic floor muscles to be able to support the bladder neck. So that is one of the most common things. In pregnancy, it can happen from as young as 15. We actually see lots of teenagers with stress incontinence, believe it or not.
Wow.
Yeah, and I won't go into all the whys and wherefores now, but yes, it can happen at any age. So anybody listening, recognizing this for their teenagers, there is stuff that can be done, and don't ignore it. But the other one is frequency. And so that is going to the toilet very often and just doing lots of little wees. And it's that safety wee before you go out in the car, or you're going off somewhere, or when you know there isn't a toilet and then you start finding that you suddenly need the toilet. So that's frequency. But there's also urgent incontinence, where you again have got that urgency but you don't get to the toilet in time. And I think the nearer you get to the toilet, then the worse it gets, because you're like, I'm nearly there, and it can be as you're taking your trousers down that it's like, oh, I couldn't hold it. And all of those things are really inconvenient. They can really actually make a difference to our choice of activity, be it the exercise or how long you go out for your walk.
Yeah.
I hear this so often of where people go, they will be looking straight away, taking sort of like little like mental health check of like, where are the toilets here? If I'm in town, which toilets can I get to? Which coffee shops have got a toilet that I can use? And then again, changing the type of exercise that they partake in. And we can keep adding in these changes of our lifestyle that actually then reduce our choices that we take on board in life. And we don't want to reduce our choices. We want to have as much choice and flexibility in what we want to do, and not have to worry about what we're wearing because we don't want the pad to show, or I mustn't laugh too hard. And I think also, if you've had a few wines, then all of those things can exacerbate. So you're more likely to notice that you could experience stress incontinence when you're belly laughing after you've had a drink, or the frequency, because they're irritants to the bladder as well. And our bodily reactions aren't as strong. So there's lots of different factors involved there. So they are the urinary incontinence things that women notice. But then constipation can occur in pregnancy, quite for anybody, but in pregnancy we can notice constipation, but then in the menopause we can notice constipation. And actually it can begin from childhood. And again, I could talk a lot about constipation in childhood, but we're not going to today. But once our bowels have got into a certain habit, they can then continue. They don't just suddenly rectify themselves. It gets into that way of pattern, and it's about breaking that pattern and supporting our bowel health. So in pregnancy, and then also menopause, constipation is often a symptom that we do kind of all generally recognize that can occur. Very often, if you've got constipation, then that can also irritate the bladder. So they can coexist quite often. So to keep that one in mind. And then pelvic organ prolapse, that can occur postnatally. It's good to know that with pelvic organ prolapse, that give it 6 months, so postnatally, before you start to really worry, because it can take 6 months for everything to just get back into its normal position. So don't be too alarmed if you first of all think, oh no, what's going on here? Do get checked, go to your GP, ask for an examination, but be aware that they often will say, wait till 6 months for us to sort of like consider any further, because things could be looking a lot different. And then come menopause age, 50% of women will have some form of pelvic organ prolapse. Symptomatically, we can all be different. So you may find that you may have a prolapse and not even be aware because you haven't got any symptoms. Whereas somebody else may have a more significant prolapse and they will go to the GP because they've noticed it, they've felt that shift, or they've noticed that they can feel a bulginess towards their vaginal area. You can have a rectal prolapse and you can have a urethral prolapse as well. So again, symptoms are going to be dependent on the individual and if you are aware of it or not, and if you need to then take action because of it.
That's 50% of women, so over the age of 50, will have some or do have some form of prolapse. That's incredible, isn't it?
Yeah.
And so if you didn't have symptoms, does that mean then that you would just be happily going along about your business, just doing all your normal things that actually could be harming and making that prolapse worse and develop more?
It's right. So I've had a prolapse, and I think we also actually just need to mention what prolapse is, because many women actually.
What is it? Yeah.
So a prolapse is a change of position of your bladder, your uterus, or your bowel. So if we say my head is the uterus and here's my bladder and my bowel, and that they're all sitting in their true anatomical position, it could be a slight shift, and you don't need much shift for you to notice it. So there's the true slight shift, and that slight shift can occur for scar tissue, muscle weakness, ligament weakness. I've forgotten what your question was now.
What is a prolapse?
Oh, there you go. So yeah, I'm answering it. So a slight change, and like I say, that can occur rectally as well, and on the urethra. It won't necessarily get worse. That's where I was coming to. So when I had mine, I felt a sudden shift, and I felt like I needed to walk like a penguin and be really aware of what I was doing, because I felt like everything's going to fall out, and it isn't going to just all fall out. But it is about having a good regime in your exercise as well. So if the muscles on the outside of your pelvis and your deep abdominal muscles and your lower back muscles are all in good balance, then you need strength in your core unit. You do need strength in your legs and your glutes to then help you with your posture and for your activity during the day. Because if you aren't in a good condition within your muscles generally, you won't hold yourself so well. You won't have the energy for the whole day. If you're out shopping all day, the carrier bags will be putting you down rather than you holding the carrier bags. So a good fitness regime is my recommendation.
Would you say strength training is crucial in regards to us as women aging well, which also includes helping our pelvic floor to remain strong? And like you said, it's also just daily things around the house, like hoovering, isn't it? And just general daily activities that we do, which we wouldn't really think we're doing a lot to our pelvic floor, but actually do have a big impact on that. So if we're not strong and we're just going around our daily jobs like hoovering and things, and our pelvic floor isn't supported, then those little jobs can also have a negative impact.
Yeah, and if we just do a very small example now, so if I bring my camera down, because this kind of like got my jumper there, keeping my knees warm. Let's move my jumper out the way and move my camera further down. So here's my table. If I was to put my hands on the table, and while I'm sitting in the chair, if I pull my body to the table and the table towards me, actually straight away I can feel that there's an engagement of muscles activating, not having to pull up really hard, but there is an activation of muscles within inside my pelvis. Likewise, if I was to push away or pull apart or pull in. Now that's a very slight, and it's worth trying, ladies. It's a very slight amount of effort, but it does go straight to the pelvic floor muscles that are supporting us and supporting the pelvic floor organs. So if we were to transfer that into daily activity of our job role, of picking up children or housework or any number of things, we're not even mentioning exercise, you know, if that effort goes down there, then yes, if we've got good balance of muscles throughout the whole core unit and our thighs and our buttocks, then that is going to be helping support those pelvic organs.
And what is the best? So what would be the best forms of exercise and strength training that you can recommend to women to be doing to prevent prolapse later on, just to keep all the pelvic organs nice and in the right place and strong?
Okay, there isn't one exercise that I would say is the recommendation. It's more about the technique of whichever exercise that you're doing. So it's really looking at getting that best technique. So, you know, listen to your trainer, think about being tall in your back. So if you're tight in your back muscles, then you've got less flexibility. So you need flexibility, you need the strength. So it's the combination of the two. So without flexibility, then you're going to get a tight muscle, but then you lose some of that range of movement that is available to you. So you want to have flexibility around the hips as well as in your back, to then also then have the strength to then get the best range of movement to enable you to do the exercise you're doing with the best technique.
Yeah, no, that makes total sense. So are you talking about kind of obviously working on your posture, so your core, and then like lunges and squats, you know, all those kind of
Pilates, yoga, running, strength, gym, snowboarding, whatever it is. It's about having the technique so that you're the one in control of whatever it is that you're doing, rather than finding that you go to do your squat with an overarm weight, but actually you're bent over, or you go to do your squat to touch down to the floor, but you're hunched over. We want length, and then that takes offload from the pelvic organs, because if you're rounded and your belly isn't coming into play with that natural engagement, then straight away you're going to be putting load into the pelvic organs. That's not a problem, but actually we want those bigger muscles to be able to sort of like offset that load, which then means that when you're doing the activity, the muscles you are targeting, such as your back or your abdominals, they'll be actively engaging. So as long as if the muscles that you're targeting are engaging beautifully with your technique, your pelvic organs will be loving it too.
Yeah.
When you take
so like you say, technique. So when you're at the gym, this is why I work with personal trainers, because they are always correcting my technique to make sure I'm doing everything really well in the right way. So that's, you know, why I think it's really worth investing in having some personal training or some one-to-one sessions to make sure that you are doing it correctly, isn't it? Because we could all be going to the gym and doing whatever, but actually whatever we're doing is harming our body in some way, especially with the pelvic floor.
But there's the costs involved. So if we're looking at, and what you said is brilliant, and some gyms, they will give you a free assessment within your gym membership once every 6 weeks. With my personal training clients, I've got some that will come to me for once a month, and so then we've got the list of their exercises. I can see their technique. We can do little mini videos or whatever, so that they can go home and practice with those teaching points, and they know where they're working to. So if you need to do it where you're reducing costs, that's some of the ways that you can do it. But if you are able to have a PT on a weekly basis, fantastic. It's or group exercise class where you know that the teacher is really on board looking at your technique. So you're going to have some group classes where there are big numbers, or the teacher is just, you know, it's follow me. Whereas if you've got a teacher that is interacting and checking, that's what you're looking for. So there's lots of different ways of being able to do it. PT obviously is gold standard. If you haven't got the funds for that, there's other ways around it. But be mindful of the technique, and it's things like breath and load, and listening to your body. Your body is talking to you the whole time. So when you're exercising, just be mindful of like, oh, my kneecap's hurting on that, because if my kneecap is hurting on that, I need to change it around slightly to support my kneecap. But likewise for your back, likewise for your shoulder, and likewise if you're finding that when you are doing your exercise, you're more symptomatic with your pelvic floor, then that's your pelvic floor talking to you saying, actually, in this exercise, i.e., if you're doing, say, let's just use boot camp for an example. If you're doing boot camp and experiencing leakage on your star jumps, well, don't just keep going on with those star jumps, ignoring it. Think about how you can modify that star jump so you can actually work to the level your pelvic floor can cope with to then build on it, because you want to build it. You want to get to your star jump. So I'm a massive advocate of being able to get to where you want to get to and not limiting everything, but it's actually doing it by that step-by-step process. And if your instructor, if your PT instructor can't modify things so that you're not symptomatic to then steadily increase, then you need to think about looking elsewhere. Using your breath as well, and how you transfer your body weight load. You can do a jump where you are banging hard into the floor and you're shocking through your ankle joint and your knee joint in your back, or you can land it where actually you've got a smoother transition and you're taking the load into your thigh, into your glute, and you can use an exhale on that load. So all of those things are real good pointers on how you can actually avoid stress incontinence or frequency or prolapse symptoms after exercise or during your exercise. Listen to your body, it'll be talking to you. Even in yoga, don't think that yoga is going to be because yoga is fantastic. I teach it myself, I love it. But there's going to be certain moves that if you've got a prolapse, you can feel your prolapse more. Modify that move. There's a million ways to do a stretch for every part of the body. So you can change it slightly where, now I don't feel that symptom. That's going to be a lot more pleasurable for a start.
100%. So just going back before these symptoms arise, so when we're pregnant and when we are after we've had our babies postnatally, what can we be doing then to look after our pelvic health to prevent issues coming later on in life? Because we know there's a huge connection with that, isn't there, with childbirth and then women experiencing many more problems as they go through menopause. So what can we be doing earlier on in our lives to prevent and help that?
Okay. There is one other symptom that I want to also mention that we haven't brought in already, and that is pelvic pain. So look out for pelvic pain as well, because if you find that you get pelvic pain, that obviously could be anything from endometriosis, but sometimes women are experiencing it when they're standing too long or sitting too long, and lower back ache that is coming in towards their coccyx. So again, that's another very common symptom that women will experience. And also painful intercourse is a really common one as well. When I do the health screen for the Adore Your Floor program, I reckon 50% of women would tick painful intercourse.
Right.
People don't talk about that.
No, don't.
You don't, do you? That's a very personal, it's between you and your partner. You may not mention it to your partner because you don't want to disappoint them, but then you don't want to mention it to even your best friend. So again, painful intercourse is another very common symptom that I hear women talk about.
And that is caused by the misalignment.
It can be caused,
and also we haven't touched on it yet, but we will be, one of the big causes of all of these symptoms is low estrogen, isn't it? But we will talk about that a little bit more in a minute. But let's so those are other really valid and very important symptoms there, and I will list the symptoms as well in the post.
Okay, well done. Good luck with that.
It'll be very long.
One of the other reasons for pelvic pain can be very often inner thigh muscles. If you look at the inner thigh muscles, going to get the pelvis out, warning here. So the inner thigh muscles will attach right to here. So if you're really tight on your inner thigh muscles, but also if you've got excessive tightness on your hip flexors, hamstrings, and around the glute area, any particular tightness can resonate directly into the pelvic floor group. So again, pelvic pain can happen for many different reasons. That's one of the others. And again, breath work or anxiety, shallow breath. So our breath will literally feed into the pelvic floor. So we breathe 20,000 times a day. So we're looking at pelvic pain. Maybe if you've got pain, the first thing you do is shallow your breath to cope with the pain. But actually, if we can get that breath nice and deep, and that's a whole subject in itself, but it's a science in itself. And there's many different breath methods you can use. I keep mine very short and basic because I'm not a very patient person. But if you can bring in your breath work with your yoga, with your Pilates, with your meditation, or just be aware of what your breath is doing. Our rib cage is 360, so the breath should be resonating all the way through that rib cage where our diaphragm is sitting. And I'll keep it at that with the breath, but that all of those things can actually resonate to increasing pelvic pain, and we can definitely do things for that. So don't put up with. So all of those symptoms, and then going back to what you said about pregnancy, was your question, going back those few minutes, what can we do in pregnancy?
Yeah, so what can we be doing earlier on to help prevent the issues later on? So when we have a baby, obviously suddenly everything changes, and anomaly, our structure, our posture, everything changes completely. And then, as we go through pregnancy, the weight of baby, and then what kind of birth we have, can all have a massive impact, whether we've had tears, cesarean, what we can be doing to help prevent any further issues later on down the line.
Okay, so the first thing I'll say is happy posture, happy pelvic floor, because again, it's a bit of a science, but if we get round shouldered, our breathing mechanics aren't so effective. And I just mentioned how the breath actually works with the pelvic floor for circulation, etc., and alignment of the pelvic organs and the pelvis itself. And we know that the posture changes dramatically in pregnancy, or can have a tendency to. So as our breasts get larger, we become more rounded and tighter through the upper back. In pregnancy, let's really work on that posture. If it's with a pregnancy class trainer, or from your own knowledge, on retraction exercises for your back, lengthening exercises for your chest, and then also how you're standing on your feet. Because then if you've got the sway back thing going on, your pelvis, if it's in a fairly neutral position, but then you've got a sway back going on, then again, the change of the pelvis alignment will actually transpire down to the pelvic organs on how they're sitting as well. So posture is number one, and that will resonate from the feet up to the neck down. So being aware, and obviously I don't want to get too nitpicky on it, because life is busy and our bodies are fantastic and our bodies will cope, and that is absolutely great. But if you are looking at good, happy pelvic floor, if you can get your posture to the best that you can with regards to how you're standing and how the muscles are reacting, you're going to have a much happier pelvic floor that will be more reactive. So that is number one I would consider. Yes, the hormone levels change dramatically in pregnancy, and so that could, and obviously the pressure of the baby sitting on the pelvis, within the pelvis, and all the weight of the baby, that can increase stress incontinence, that can increase frequency, that can increase constipation. So all of those hormonal changes will have an impact to those areas. That's normal, and just go with the flow. Because at the end of the day, that happens. But be aware of your pelvic floor and get to know your pelvic floor. Because if you understand how your pelvic floor is reacting, then you can work with it a lot easier. So try to get in tune. One of the things I love doing is when I'm lying in bed, and as I'm going to sleep, and I'm just doing my normal going to sleep breath, and my eyes are closed and I've got no distractions, and you kind of go into yourself and just notice that actually when you're lying in bed and about to go to sleep, that you will feel the breath in your rib cage, and you'll feel that breath go transpire to your tummy, and you'll feel the breath transpire to the widest part of your hips on your lower back. That will be going on, yeah, and that will also then transferred down to your pelvic floor. And in fact, what I love doing, you might even notice it now, Sarah, if I get you to ask to try this now, is if you put your hand on the widest part of your hip, sort of like where the fleshiest part is at the top of your bum.
Yeah.
Okay, and just sort of like think about breathing down your back to your hands. Now, you're sitting upright, you're in a chair, we're not in the normal position, but if you can feel that underneath your hands, so I'm going to try. Yeah, you feel that? Okay, so when you're in bed, that's a lot larger. You notice it much more. If you think when you're in bed, breathing down your back or down to your pelvis or down to your anal area, breathe directly down to your anal area, you'll notice that actually when you're in bed, you'll feel that going on around your anal area. Just a very subtle, but it's a really nice calming thing for anybody. I'm not the best at meditation, and yet that is
You're just linking in, like you say, you're totally tuning in to your body, and how your breath is really an important, hugely important element of the way we work physically, mentally, and emotionally. Is without that, and because so many people are just very shallow breathing, all those structures in the body are becoming very restricted because they're not doing this, like you say, they're just like this. Like a hypertonic pelvic floor, for example, when it's really tight, causes a lot of problems, doesn't it?
Yeah, absolutely. And I was going to say something. That's it. So basically, as if you're doing that kind of breath when you're going off to sleep, it's a really good way to calm the brain as well. And
that felt really nice just doing it there for that couple of moments, to be fair.
Try it in bed as you're going off to sleep, and I can't guarantee, but I know that I fall asleep very quickly when I do that. And it's normal breath. If you want to do a big sigh, a big breath, then great. But a normal calming breath of going to sleep, it just brings you into yourself, and it just calms the brain as well as the muscles enjoying that circulation and rest. So that's another, the posture thing resonates to the breath. The breath resonates to your pelvic floor muscles. The other thing you can do in pregnancy is, the breath will resonate with getting in touch with your pelvic floor, to starting to notice it. I think that with the pelvis, and when people talk about the pelvic floor, we can't see it. And so then it's really hard to sort of like get in tune with it. Whereas if I was to do a bicep curl, I can see my muscles working. So then I can see it happening. Or if I was doing a squat, I can see my knees bending. And so then I've got the visual. My brain goes, well, yeah, there's my bicep curl. There's my arm moving. And so I can connect with it. But when it's inside your pelvis, it's really hard to actually connect with muscles that you can't see. And also it's just sort of like we don't look at our pelvic floor muscles. We don't look at our vaginal area, our anal area very often. So we don't ever see it. And so we can kind of disconnect with it. And in fact, if it's not behaving as we would like, we can then really disassociate ourselves from it. Because it's a frustration area. So if it's not performing the way you want to, you can't see it. It just becomes this entity that's apparently somewhere inside your pelvis. So that breathing thing kind of like brings it to life, and you can like, oh, I can feel it, and you get that connection. So I think it's gaining that connection of those muscles initially is really important for all women. In pregnancy, it's really important because then postnatally, you're going to be in a better place to be able to connect with them, to then go for some rehab and pelvic floor muscle training. But also if you are looking at having a vaginal delivery, the pelvic floor muscles have to relax to let things out. And so if you haven't got any connection with your pelvic floor muscles, suddenly you're having labor, and if it's your first time round, it's like, oh my word, you're going to feel things that you've never felt before for the first time. So actually understanding your pelvic floor helps you in the moment of labor. Now, if you've got a good reactive pelvic floor, and if you're in tune with your pelvic floor, if you've got good strength in your pelvic floor, in labor, then basically the second phase of that labour can actually be faster, which is fantastic. But also being in tune with how that pelvic floor is reacting. It's not going to be like, this is like the first time I felt anything like this going on. You're going to be like, yeah, okay, I know what's going on here. I know what's going on here. And you can work with it easier. So yeah, again, keeping in tune your pelvic floor from the breath work, feeling it when you're going to sleep and you're breathing, to then realize it is moving. It does have a lot of move, and in labor there is it's made to actually open out, and so the baby's head is crowning, and then and then it's made to also come back. It does come back, you know. So it's feeling confident with those muscles so that you feel more confident if you're having a vaginal delivery. But if we go back to pregnancy, what can you do? Pelvic floor muscle training, but it's learning how to do it correctly, because there's no point doing, if I was to do a press up and I'm doing that press up really badly in normal exercise, I'm not going to get the results that I was hoping to achieve. It's going to be more or less a waste of time. So it's learning how to do that pelvic floor engagement correctly, from engagement to then relaxation. So it really is getting that full range of movement, just not a small range of movement. We want full range of movement for full activation and relaxation. And the reason why you want to get into pelvic floor muscle training in pregnancy is if the load is sitting on there, you've got more and more load going on. We know that losing a few pounds in weight for all women, then you're less likely to have so many symptoms in prolapse, and you're going to have less stress, urinary incontinence, etc. But of course, in pregnancy, that load is getting bigger and bigger and bigger by the week. So yes, you need a good reactive pelvic floor group to cope with that load. So pelvic floor muscle training is useful in pregnancy, but then come week 35, you really want to get into this whole relaxation of that pelvic floor as well, in preparation if you're having vaginal delivery. So again, that would be then looking at really ensuring that you are getting, if I was to do a butterfly stretch, lying on my back, my feet and knees are together, and then I drop my knees apart, that's a butterfly stretch, and then a nice tall stretch of the body, Again, having that open space, stretching around the outside of your pelvis, so your inner thigh, outer thigh, your glutes, your lower back, your lower tummy, inner thigh muscles, get some length and stretch, a nice deep breath. So we know that when you inhale, the pelvic floor will go like so. So you can incorporate your stretch and your breath to then help with, again, preparation for birth, for later on in the pregnancy.
One of my favorite yoga poses is happy baby.
Love it.
I love that. I just feel such an amazing stretch and release in all my hips and pelvic floor when I do that stretch. But yeah, so like you're saying, it's very, very important that you include some pelvic floor training with the right people. And of course, we'll share all your details, Louise, so that people can find a really good coach to work with for during and after pregnancy. Also, we need to talk about, I think, that the use of topical estrogen, especially if you have had like a tear, or you've got scar tissue vaginally after childbirth, that this can also impact you as you go through menopause later on, causing lots of issues in regards to pain, restriction in the tissue, because as we go through menopause with our estrogen declining, we lose a lot of collagen, elastin and hydration, which then means that all of our vaginal area, our vulva perineum can become really quite tight, can't it, and inflexible and rigid and dry. So at that stage in our lives, replenishing estrogen at a topical level can also really help to prevent issues further down, can't it? And moisturizing it, keeping it nice and hydrated.
So it's quite ironic that you've got one stage of our life where we are having babies, maybe, and then there's another stage of our life where we're finishing the baby cycle of life.
Yes.
Yeah, actually, the symptoms within the vagina can be quite similar due to the change of hormones. So absolutely, and I will I will add to that in one moment. I think immediately postnatally, if you can get some good postnatal care, that then sets you up for a happy pelvic floor and muscles leading up towards the menopause and thereon. Because it's very easy that when you're in your 20s or your 30s and there's no symptoms, the last thing you can be bothered to think about is your pelvic floor. Because if you haven't got any symptoms, then everybody's happy and you're not going to think about it. But if you can actually postnatally get yourself in a good place of a good postnatal check, to then do rehab rather than going back to straight full fitness. Be aware of the use of topical estrogen. So topical estrogen postnatally is for breastfeeding mums in particular. Not all breastfeeding mums will notice it. It's more if you do get those symptoms of where your vaginal area, your vulvar area feels aggy. I think that's the easiest way to describe it. It just feels aggy. Suddenly you're noticing that you're thinking about it when you wouldn't normally. And yes, it could be splitting of the vulva, it could be soreness. All of those things are signs that maybe actually there is some vaginal dryness going on, and you can have topical estrogen if you're breastfeeding postnatally. And it's the breastfeeding hormones, the change of hormones because of the breastfeeding. So you could be breastfeeding for 9 months or longer. So then you've got a good duration of time where actually topical estrogen could be useful. And just see your GP and healthcare provider, and then you can ask them about that. Again, postnatally, with your postnatal check, there's different ways. Some GPs aren't doing any postnatal checks. It's very much dependent on the surgery itself. Some GPs are doing a 6-week check for the mum and then doing an 8-week check for the baby. Some GP surgeries are doing a combined check at 8 weeks. So there's going to be different concepts of if you get a postnatal check and when it will be. But it's really important that if you are having your postnatal check, that if you have got an abdominal surgery scar, you have it looked at. If you've had a vaginal delivery, you ask them to check your perineum, check your pelvic floor, because that won't automatically happen. Some will do that automatically, but there's many a postnatal check that won't happen. So do ask for it. None of us are like, oh, let me get the scar out and you've got to undress yourself. Oh, let me get my pants off and I need a check. Because it's sort of like the doctor doesn't actually request you to do it. It's oh, I don't have to do that. Great. That's one less thing. But actually, please do. Because if you've had knee surgery, then actually you go up for a follow-up with a consultant or a GP. The first thing that they'll say is, let's have a look at your knee then. And they will look at your knee. They naturally do that. They're not going to just say, so how does it feel? Good, okay, and then off you go. They'll look at your knee. And so we need to be checked so that actually a medical provider can just check everything really is good. And if there's anything that's flagging up, and give recommendations. And if you are having the check with the baby, the focus is so often as from the mother's point of view on the baby, because the baby is everything. And on the medical side, the focus is very much on the baby. So do ensure that you do voice out yours. I've been in that position myself. And literally, it was when I had the twins, so there was 2 babies, and it literally was, and are you okay, Mrs. Field? Oh yeah, I'm fine. And you're still, you're getting the nappy on, you're getting the nappy off, you're taking their items of clothing off, you're giving them a jiggle, they're due a feed in a minute. And so you want the baby sorted, and there might not be time for you to be able to, due to the baby needing a feed or due to the time constraints on the appointment, get yourself checked, because happy mum, happy baby.
Yeah, so important. And also, the more children you have, especially if there's smaller gaps in between, is that going to increase, your likelihood of you then having some issues?
Yeah, absolutely. Be it abdominal birth or vaginal delivery, either way, then there are going to be higher increases. You've got a higher increase of all of the symptoms that we've just mentioned earlier on.
And I also know from my own experience, so I had 2 boys in my late 20s, and I felt my pelvic floor just bounced back really quickly afterwards. I was fortunate to have vaginal deliveries. I had my 3rd son when I was 42. That was very different. Yes, I had a wonderful birth, vaginal delivery, and it was all great, but I could not believe the difference afterwards with my pelvic floor feeling like it was never going to return back to its normal position due
Yeah.
to me being much older.
Yeah, and in fact, actually, I always say I'm going to get my mirror out. You know, we check our lips every day, maybe in the mirror, or our eyebrow shape, or whatever it is that we do.
Yeah.
There's more to do now, isn't there, on the face, isn't it? Lip
Yeah.
liner, eyebrow liner. But we need to check the lips down below. Know your own normal. There's 5 gynecological cancers. We need to know our normal. And the only time I used to look down below was after each baby. I would like, oh, what does it look like now? And like you, my first delivery, I was very young. Oh, that looks the same. Ha! And the second vaginal delivery, oh, that looks the same. Third delivery, not looking the same. And I had twins, like that ain't the same.
Yeah, it looks a bit different now.
Yeah, the delivery and age and genetics all come into it.
Yeah.
And it's not about what it looks like, but obviously how the performance of those muscles and if they need any self-care afterwards. So yeah, but we should be checking. We check our breasts once a month, and we should just be checking us down below for many reasons. There's other conditions such as lichen sclerosis. There is just, know your own normal, because otherwise you won't. And also know your own body parts. So I've got things. I'm not Blue Peter here. I've got things that hang all over the place. So again, every vaginal area, every vulva is different. Everything on the outside is vulva. Everything on the internal is vaginal area. And there's our anal sphincter here. The lovely perineum would be in between here. Notice they're really close together. There's not a lot of difference. So if we were to have an episiotomy, that's more of a controlled cut, and that obviously wants to heal up nicely, but scar tissue will occur due to the process of healing. If we were to tear, then what we're looking for postnatally is how large that tear is, and if it's gone to a 3rd or 4th degree, and on the internal sphincter of the anal area is where bigger problems do occur. So again, these are all the areas that you want to get checked, as well as your abdominal scarring, if you've got abdominal scarring postnatally, to then know how you need to progress further onwards, because again, we can also help manipulate the scars to then become smoother and glidey, because our scar tissue will heal like that, and we need it nice and glided, but we need a certain amount of scar tissue for the healing. So it's that whole process of how long the inflammation is going on to how that scar tissue will heal as well. And so there's specialists out there that can really help promote good scar glidiness, so that actually we don't get a pull from the abdominal scarring that can aggravate all the way up through our shoulders and our pec muscles, and create aggravation later on in life. Again, it's later on in life you're more likely to notice it. With an episiotomy, your episiotomy may heal beautifully. Fantastic. But then come menopause, it might start to feel a bit aggy. I noticed that when I was in my perimenopause, if I laid on my back and opened out my legs, where I didn't feel the perineal area, I started to feel like, oh, it feels a bit tight around my perineal area now. So again, massage is great. Perineal massage in pregnancy, that's a good one. We mustn't forget that definitely. One. And then you could do the same post birth, and products such as lubricant. There's many out there, but again, it's getting the lubricants that have not got the pH nasties in there. So yes, it's a good product. Subtle is a good product as well. Silk as well, and there's other moisturizers as well. Oh God, there's another one that I love. I think it's upstairs in my bedroom. There's many other products out there. Yes, it is. And I can't think of the name, so do forgive me. But it's checking there's no glycerins in there.
Yeah, really good. Just very natural lubricants and moisturizers. So down there, very important. So just to finish off. Let's quickly go over then what women can be doing when they're going through menopause and they are starting to experience, vaginal atrophy, soreness, dryness, stress, urgency, stress incontinence, all those kinds of issues, UTIs and things like that, which become really common due to our declining hormones. It's really, really important, is it, like we said before, not just to accept it and put up with it, but actually going to your GP and adding in some topical estrogen cream can be so amazing to help reduce all of those symptoms, and for many eliminate those symptoms. It can be taken alongside HRT, or you can just take it on its own as a treatment, can't you? You don't need to be on HRT at all to take it, but it is something, again, that lots of women I see have never heard of it. The GP has never even mentioned it. So topical estrogen cream is going to replace the lost estrogen in that area of your body, which will then mean you'll have less stress urgency, less stress urine frequency, less UTIs, and less dryness, less pain, all of those things. Something so simple. If you are experiencing any of those symptoms and you haven't heard of it, please ask your GP. And also, now if you're 50 or over, you can actually get Gina over the counter in Boots, can't you? So that is something also to be aware of, which is a topical estrogen cream. Otherwise, if you're younger than that, then please ask your GP for a prescription for it.
Yeah, and obviously there's the different types. So you got the ring, and you got the pessary. The pessary is really clean and easy to use, but then the cream, what's nice about the cream, and that's the one I have, so I don't have a pessary, I've just got cream, is that you can actually use the cream on the perineal area, which is going to be great for any scar tissue or tightness. It can be used on the vulva area if you've got splits and tears, which again is really useful. I wouldn't have been without it for myself personally. And I was going to say something else about the cream.
Does the cream also help if you've got any fissures?
Yeah, I think so. But again, check with your medical provider, they'll be able to say for sure. The other thing I was going to say is it's really good if you've got pelvic organ prolapse, because then that is going to the topical estrogen is going to be really feeding to the connective tissues. So pelvic organ prolapse, you should be able to get that automatically, even if you're not experiencing vaginal dryness. It's nutrient to the connective tissue, which is really important.
So that is definitely something you would recommend all women who've got pelvic organ prolapse to be also having, is topical estrogen.
Yeah, I mean, I think the main thing to consider for all women is that where we don't see those pelvic organs, where we don't see that pelvic floor muscle, it is a living, breathing thing that is moving all of the time. It's moving with your breath, it's moving with your movement, every single movement. It takes pressure when you push or pull or press out. It is functioning constantly. And it's when we educate ourselves with regards to what is actually going on down there, then we're typical thing of like, we will empower ourselves, because then actually we can look after it by avoiding bathroom habits that aren't useful to it. And there's many bathroom habits that aren't useful to our pelvic floor.
Like what?
Okay, don't hover over the toilet. I know so many of us will hover over the toilet. If you hover over the toilet, you're more prone to UTI for a start. You can't empty your bladder properly. So hovering over the toilet, and if you get frequency, then hovering over the toilet and you're not emptying your bladder properly is not going to be conducive for a start. The other thing is going back to all women, and it's useful in pregnancy as well, is to put your feet on a stool. I've got one here. So any stool, I'm not advertising this product. It can be a flip stool that you have in your kitchen where you get your saucepans, but to have your feet flat and wide through your hips will then help promote emptying your bowels and less straining. So in pregnancy, you don't want to strain and you want to promote emptying your bowels, but in menopause age, again, you don't want to strain. So emptying our bowels actually works with our breath. So there is sort of like a breathing out like so, breathing down into the pelvis. There is actually a little brace of the upper abdominals, and then there's a flare out of the lower abdominals, which allows the anal sphincter to actually open, and that can really help pass your bowels. Again, really good for not just emptying the bowels, but again, not putting extra undue load onto the pelvic organs, and not more load just sitting on the organs all day long either. So breathing out your poo is a really good way to go.
And also because a lot of women who have experienced constipation over the years, you know, are very used to just straining and pushing, you know, all of that kind of thing. Sometimes, you know, and I have been guilty of this myself. If I'm in a rush in the morning, and, oh my God, I need to go to the toilet, but I'm in a rush, I've got to get to work, then I'll sit on the toilet, I'm like, hurry up, come out, a bit pushy, a bit straining. And I've noticed, my goodness, I need to be sitting here and taking my time with this and allowing it to come out, not pushing and straining to get it out quickly because I've got to rush off.
So if you're straining, literally, remember earlier on we said the pelvic floor is to relax to let things out. So if you are like that and you're pulling up the toilet seat and all of that, all your pelvic floor will do will go and actually shut it off. So if you do use your feet on a stool and breathe your poo out, then actually you will pass quicker and more. You'll not just pass quicker, but you pass more. So it really is worth practicing that. It takes a little bit of practice. We cover that kind of thing, obviously, in the Adore Your Floor program. There will be things on the internet that will show you how to do it. If you look up unicorn, what is it? It's the Squatty Potty Unicorn. If you look up Squatty Potty Unicorn, you will see a fantastic funny video showing you the difference of using a stool to help you will better pass through your rectum.
Well,
so
I'm going to do
that's
that.
a nice quick video to see. That doesn't show about breathing out, but it will show the stool effectiveness. So yeah.
Okay, wonderful. Thank you so much for today. Now, it's a vast subject, isn't it? We kind of touched on some of the really, really important things about, you know, postnatally, when you're pregnant, what you can be doing to keep your pelvis for strong for after you've had your baby and then later on in life, and what you can be doing to help symptoms, etc. We are going to be doing another video where we're going to be talking about rehab after prolapse and after hysterectomy as well.
And in fact, actually, that rehab would also resonate for postnatal, because you need rehab back to postnatal fitness as well. So I think that will cover all three sections again.
Fabulous. Well, thank you so much, Louise. I'll put your link to your program for any woman who is wanting to learn more about pelvic floor health and how you can look after yourself, whether it is postnatally or later on in life, whether you've had a prolapse, hysterectomy or not. I'll drop Louise's details in the link so that you can have a look and get in touch with her. Otherwise, thank you so much and look forward to speaking to you soon.
Bye-bye, gorgeous. Bye.